So I was talking about the puerperium period, which is also called the postpartum period. And this is the period that begins immediately after the birth of the child. The birth of a child, the period that begins immediately, it's called postpartum period or puerperium. Don't be confused. Obstetrician comes in after 28 weeks of gestation, or rather, when we have ascertained that this baby is viable, can survive outside the uterus of the mother, or rather the womb. Now we can say the baby is viable, the fetus is viable. So obstetrician comes in. So he or she will handle the pregnancy from then. So now we have reached a point whereby the baby is born. So the baby can be born with or without complications. So if the baby is born without complication, well and good. The necessary care is given. But if the baby is born with complications, then also the appropriate care is given. But before then, we do APGAR score. The APGAR score, A stands for the appearance of the baby. Is the baby okay? The normal color. The P is for the pass rate. Is the pass rate of this baby okay? The grimace is the what we do is checking the cry. Does the baby cry after birth? The grimace. We can have the cry or the reflexes, the baby reflexes, to be discussed another day. So after grimace, we go to the activity, the muscle tone, of the child. And lastly, we check for the respiration of this child. Are the respirations okay? So if we find that there are gaps, if we find that the baby is not normal, then the appropriate care is given. But for this case, I want to concentrate on the mother. So the maternal well-being at this point is also very crucial, because after birth, some things can happen. Some things can happen. We have 4 stages of labor. I will discuss another day. Sorry. We have 4 stages of labor. So there is stage 1, stage 2, stage 3, stage 4. So a lot of things happen in stage 4. So after birth, the mother can start experiencing what we call PPH, postpartum hemorrhage, postpartum bleeding, which is excess bleeding. So obstetrician will come in and rule out what is causing these bleeding. It may be because of atonic uterus. The uterus has failed to contract. That can cause bleeding. It may be because of retained tissues of conception. Some of the things can be retained in the reproductive tract, like placenta may be retained, and other parts of placenta, the umbilical cord, they can be retained, and this can cause bleeding. The mother can be bleeding because of tears. Yeah, the perineum may have ruptured. Yeah, the cervix also can experience that degree tear. So obstetrician will rule out what is causing this bleeding and administer the relevant care. So I'm saying postpartum period has begun immediately after the birth. And these are some of the things that can occur immediately after birth. So obstetrician will do all this. Can be bleeding, can be the pressures can be too high. Yeah, there may be signs of infection, signs of shock. All this can occur. But mainly, this postpartum period is a period whereby about 5 things occur. One, we have what we call the involution of the uterus. Involution of the uterus is whereby the uterus contracts and returns to its normal size, reduced size, to its non-pregnant state. The way it was before pregnancy, it is what we are calling the involution. Contracting, reducing size, and returning to the normal non-pregnant state. The other thing that occurs is the blood loss, what we call the lochia loss. The blood, after birth, see blood that can extend to about 6 weeks. Why do we have this blood? It's because we have said there is involution of the uterus. So there is a layer of uterus that is shedding off. The uterus is shedding off the lining, the endometrium, and all that. So we will have blood. The blood will keep on changing color from day to another. We have types of lochia, loss. I'm not interested in stating the types, but we have types like lochia, serosa, rubra, all those ones. So the blood will keep on changing color. So this blood lochia loss will go up to around 6 weeks. So if you have heavier bleeding, which is abnormal, and also after 6 weeks, you are also bleeding, you are having bleeding, you can make a point of seeing an obstetrician. So number 1, involution of the uterus, lochia loss. Number 3, the body is adjusting. There are breast changes. So the body is adjusting itself to breastfeeding. So we have changes in the breast for the sake of breastfeeding. The other thing, number 4, is hormonal changes. So during pregnancy, some hormones are elevated. So during this puerperian period, these hormones return to normal, to the normal and pregnant state. There is balance of these hormones. So it's also something that occurs during puerperium. And lastly, we can have emotional changes. After birth, a mother can be excited, but at the same time can experience undesired emotional changes like postpartum blues, postpartum depression, anxiety, and all that. So these are normal during postpartum period or puerperium. So this is the period whereby the mother should seek consultation from obstetrician in case she sees something abnormal bleeding. The uterus has failed to return to its normal size, has not reduced to normal size. The uterus is bulging, the bleeding is heavier, it's abnormal, or rather, it has a bad smell. Then also, the mother is experiencing some undesired effects, emotional changes like anxiety, postpartum depression, stress, and all that. These emotional changes can affect the mother, the bonding between the child and the mother, and to some extent, some mothers disown their child. Yeah, they disown their children because of the emotional changes. So this is the postpartum period. It's very important to understand it. So it's the role of obstetrician to walk through the mother in her postpartum period successively. So if there are abnormalities, of course, the abnormalities will be handled with the appropriate care. So I don't know whether you have understood. I just wanted to give a general introduction about this reproductive health. It's something that I love. It's something that it's part of me. I love it. So it's also good to understand your reproductive health. So all these postpartum period prepares the mother to return to a normal non-pregnant state venye alikuwa before apate mimba. Postpartum period prepares her to return to that state. So it's good we learn. It's good to all of us to understand this because it's very interesting. So for them that have gynecologic disorders, you can see the gynecology. But before then, let me repeat this. Any woman who is not pregnant, and also a woman who is pregnant, but she's before 24 weeks or 28 weeks of pregnancy, if she has any other concerns, she's supposed to see a gynecologist. But any woman who is pregnant and she's past 24 or 28 weeks of pregnancy to 6 weeks after birth, she's supposed to see obstetrician. So between 28 weeks to 28 weeks of pregnancy to 6 weeks after birth, this woman should see obstetrician. Hope you get. So those are the two phases. Those are the two broad phases of reproductive health. Hope you have enjoyed. Hope you have learned something. If you have a concern, question, please feel free to ask in the comment section. See you in the next video.